Okay. PowerPoint has okay, please. So this is now we are starting the second part. This is the lecture development for immersive BCH. This is the second class. Today, what we are expecting, we have fine motor and gross motor. Uh, Fine motor and gross motor, we are saying this is the motor function, and please make sure that you are listening well to the examiner, because yeah, they confirmed that many times. They confirmed that no more double task, and you will see by your eyes in the last UK exam there were double task in the mark sheets. And here, hearing, speech and language and social, this is called cognitive function. So here the distribution varies between centers, and we will not depend on that. Hearing, speech and language, this is the second part. Uh, as usual, we put the sensation at first. So we are talking about hearing. So usually, as we said in the vision first, then fine motor. Hearing, speech and language. We have three parts: approach, recall and presentation, and discussion. And as usual, we have here introduction, play for 5 minutes, discussion for almost 5 to 6 minutes. This is history taken with the mother, and finally finalized. Total is, this is a slide need to be changed. Total is 13 minutes. 13 minutes. So it is just, you will hear the ring almost at 9 minutes. This means only 4 minutes remaining. And after that, once you complete the 13 minutes, you will be ready for discussion for 9 minutes with the examiner. In this way, we said better to start with the history, but we put a plan that here we know the technique first, and then let's revise the history at the end. As usual, go greet, get the task, age of the child, and then use hand sanitizer, greet the mother, make good rapport, and then go make selection of the toys, while you are just saying, hello, my child, hello, my lovely, this is on the run, don't stop, because you will return back. Hearing, speech, and language, rules of survival. Hearing first, you need to test hearing first. This is number one. Number two, never point with your finger. This is considered as a non-verbal clue. Many candidates go there, and the task was like assess hearing and fine motor, and they just bring the cubes and put it in front of the child. And after that, the child continue to make the cubes you make for him, and he make after you, and he continue. The candidate does not note that the child is aphasic, so no single word, and even he has problem in hearing. So those children are very smart in reading the lips and in getting non-verbal clue. So please, you can even hide your mouth if while you are talking, little bit, not to read your lip. If he's then lion, doll, car, three tools of different categories. So you can make it lion, doll, car, you can make it lion, car, cube. So any three different, not related to each other. One is animal, one is a way of transport, and the other is a toy. This is really intended in the term of when you ask the child where that we are playing with. So there will be no, like there is a lion who is making a voice like that. So this is a lion. Which one we are using to come here, or which one we are riding? So when you ask about verbs, so nothing look alike. In UK and other multiple language countries like KSA, before going into hearing, speech, and language, please ask the mother about the spoken language at home. This is really very important. In London, I can assume that there are at least 50 nationalities wandering there and living there. and many cities like that, like Emirates, Dubai, like Jeddah. So in those countries, especially if the examiner is UK, British one, ask first of all, ask the mother what are the language you are using at home. You may find the husband from a nationality, wife from a second nationality, and the maid from a third nationality, and there are three spoken language in the environment. Here, UK case, hearing aids, and Makati Sign Language Translator. So this is one real case in the exam, and here the hearing aid, the child is wearing hearing aid, and the opening statement by the examiner, this child, please examine hearing, speech, and language. He has hearing problem, and you can use a translator. So the sign language used is called Makati, and we said this is Makati is a city in Philippines. In this situation, candidates are deceived by that. He tell the translator, please ask him what is the name, and then he asks what is the name, and then the child answers, and what his age, and then the translator do, and the child answers. So this is now he's testing the vision. He's not testing hearing. Okay, so you need to do it first. You need to do it first, and after that, ask so you make sure that he has receptive problem, and that when he got it, he do it. So this is, he has receptive problem, no problem in the expression, but the problem is in the reception. So you need to do it first. Don't be deceived on that. So if you just use the sign language, this means you are not testing the hearing at all. This is important trick to take care of. Hearing, speech, and language, we give you the tables, and again the tables here. It is very organized, well organized, and really depending on the pillar, center of pillar. This is the skill way. This is really important, and the importance does not come only from the memorization and the flash memory of the paper. It comes from when you are giving a patient an age. So you will find that this child is just going in this area, and suddenly he do one task here and then return back here. So you will be very, this is enable you to give accurate age without just saying what he did. You are following a line, and you in your mind and in your imagination to say this child is around 2 or around 3 or whatever. Here, nouns and verbs. Regarding before moving to the noun and verbs, you have a way, you have a strategy. The strategy that you go there and you collected the toy, and you need to come from behind the child. You come from behind the child and whispering in one ear or whispering from one side, and just announce his name. You can just say any name according to the child. So Harry or Sarah according to your child. So if you turn to voice, this is simple, the basis of distraction test. And you are now, this is based on scientific issue, which is the base of distraction test. If you can just get from behind and the child turn to voice, this means he can hear. And this is a very simple. Now we get someone who say, so what is the use of that? I will come from the front and I will ask him, what is your name? Okay, so what if you have a child with intellectual problem? So if you have a child with intellectual problem like a Down syndrome and he's younger, he's not responding to the name, or he does not understand you. So this means at least you did it, and now you are sure he's hearing. Sometimes child with global developmental delay, he can hear, he can turn sound to voice, or sorry, head to voice, but he does not understand. And if you ask him, what's your name? He will not understand, he may not answer you. That's why this is a very simple step. Come from behind and just whisper the name, and if he turns, this means he understands you. You can test that in both sides. This is really very simple, and you have a base. This is the base of distraction test, usually done at the age of 7 to 8 months. Then after that, you will come to sit to the child, and before playing, you just again there. Okay, hi sweetie, what's your name? And if he can say the name, this means he's 2 years. And what's your full name? if he can say it now, because just it is look like a sequence. You are a boy, or you are a girl. This mean again sex and age. How old are you? And if he answers, so now I am moving with the child just to see where I will put my center of pillar. If he just to go with me and say address and full name and even birth date, this mean the child is 5 years and I need to test around this area. Okay, and this is, we have a usual plan now. Name, that's why we are calling this a CV, curriculum vitae. CV of the child, name, age, sex, address, full name, and birth date. That's why. Number one, CV, and number two, can you sing a song? And if you are smart enough and you are living in the country where you are examining and you know the most popular song there, you can use it, okay, like Bata Cake, like anything which is looks like a popular rhyme. If you cannot, ask the mother, does he have any favorite song? Can you sing it, and or ask him to sing it? So here, this is a very good way to ask the mother about the popular song. Uh, and especially in the area of the song, uh, famous in Egypt exam, we said it many times before, uh, one patient, please assess this patient hearing, speech and language. And 6 candidates examined in the same child, only one get clear pass because he is the only one who can lead the child and encourage the child to sing. He just started to catch her hands and lean with her and dance with her, and then after a while she started to sing with him, and after that both of them enjoyed the game, and it was very nice. So encouraging, just clapping or catching the hand or leaning with her, let's dance with that, or just even uh, play a game like bata cake with the finger and hand. This is even could be joyful to the child. After the song, you ask him, are you able to tell me a story? And if he's able to, this means your child is uh, 4 years old. So sing a song at the age of 3 and tell a story at the age of 4. After that, you ask him, could you count? Child at the age of 3, he count to 3, and this is looks like now a music 3, count to 3, and after that, start to skip some points. So you just say 1, 2, 3, 4, 6, 7, 9. So it's just a skip, not in order. But 4-year-olds is supposed to count to 10 regularly. Uh, I'm just sorry, 1 minute. If anybody, I'm sorry. Dr. Fatma, we have Dr. Fatma. We have Dr. Fatma, guys. So are you able to unmute yourself? Just raise hand. Okay. I'm sorry for that. Okay, now we have Dr. Fatma just returning back a little bit, one step back. As we said, the introduction as usual, then we will go to the child, to the examiner, get the task, talk to the mother, greet her, and then run to collect the toys. After that, hearing, speech, and language, we have rules of survival. Hearing first, always test hearing first. I'm sorry, guys. I'm sorry. Just a rapid review. We are just started. Here's Dr. Yabreen. Sorry to use another ID name. It's okay. Okay, rules of survival, hearing first. And we said that if you have any sense, you need to stress on the hearing and you need to test for hearing, especially if you have double tasks. This means you are going always to sense for the sensation. And never point with your finger, never use your finger to point at anything because this is considered as a non-verbal clue. Child may be mute, maybe deaf, maybe, and even though he can read the lip and follow the fingers and do many tasks, and many candidates miss that the child is avasic and not talking because the child was fine motor and hearing and he was doing everything. Bridge, he's doing bridge. Tower, he's doing tower. Cutting, writing, everything he's doing. And that's why some candidates get distracted. That's why we are saying always test hearing first. Selection of toys. All toys of cognition are the same. Feeding tools like a spoon, like a cup, like a knife, like a fork, plate, small plate, and then lion, doll, car. We said any three tools from different category. One animal, you can displace the doll with, but the doll is important for us because we are using for the pretend to play. That's why we just say these three tools, lion, doll, and car. We said this is intended to bring three difference because who is making like the sound of line and which one we are driving. So we are talking about testing the verbs. And in UK, we have other multiple language countries like KSA, like Dubai. You need to ask about the spoken language at the home. This is extremely important. You may have three language or two language in the environment. And sometimes they are speaking different language. Let's say, for example, you have a child Pakistani, they are using Urdu, but you cannot, you are using Arabic and English. That's why now what you are doing, you need the help of the mother to translate. That's why, please, in any when we think that the family or the child is speaking a different language, please ask specifically and make it as a habit in hearing, speech, and language. What are the language you are using at home? This is written many times in the feedback. You did not ask the mother about the spoken language at home. This is UK exam trick. They bringing a child with hearing aid and opening statement. This child has hearing problem and he's using Makati sign language. And please, you have a translator, you can use him. Candidates who are not primed and does not know the trick, they just go and use the translator, and the translator just using the sign language, and he does not spoke to the child. And in this situation, he did not test the hearing, he tested the vision. So you need to make everything first to the child, what's your name? And when he did not get you, ask the translator, could you ask him, what's your age? Then now you are testing the hearing first, and if he's not able to, then you can go to the translator after that. Take care of this trick. And here we talk about hearing, speech, and language. The strategy and to come from behind the child and whisper his name and see if he's turning head to noise or to the sound. This means he can understand you. This is the phase of distraction test done at the age of 7 to 8 months. We are doing this just as a simple way to assess if he just did it. This means he's able to hear, and you can test both sides. So now he turned head here and turn head to the other side. This means both ears are okay. Why we are doing this? We will come from the front and ask the child many things why we have to do that. Because sometimes you may be met with a child with global developmental delay or child with syndrome. And when you ask him his name, he does not understand you. So how can you test the hearing now? It is very simple step and really very important. Take care of this point. That's why it is separated as a test at the start here. Then you have expressive language. This is, we are saying here, expressive language, and we have here receptive language. Expressive language, I need to know and test the child expression. That's why I'm asking. And by the way, it depends on the expression must, and this is a prerequisite for it to have intact reception. But now I'm testing if the expression is okay. This means also the reception is okay, but here I have something specific for the receptive way. This is very famous, well-known way to test the case, and many examiners like this strategies. Most of them, this is very famous. We will see now with the time and with the examples we are giving. You're going to ask the child first, what's your name? And if he's, that's why we are writing here CV. What's your name? And if he's able to do the name, this means he's 2 years. Age, name, full name, then this means he's 4 years. Boy or girl, I'm a boy. How old are you? 4. So now this means the child is around 4. And where are you living? Not necessarily to tell full address. If he just to say the town, this means he knows the address. Okay. Birth date and birthday, if he's able to say, this means he's 5 years old. Then now I can just to say my child is almost around 3, and I will put my pillar around this area. Then I will ask the child, could you sing a song for me? And if I am a good one and my child is speaking Arabic, there are famous rhymes like Mama Zaman Hagar. I will start to sing and catch his hand, try to dance with him, try to clap for him, encourage him. But if I did not know the famous or popular rhyme or melody, I can ask the mother, what is his favorite song? And I can use the mother that. Could you sing it? Let her sing with you. Could we sing it together? Just to say, and I will try to say it with you. This is very important. And the clap started to make a very cheerful environment. This is extremely encouraging to the child. He said the only one who got the clear pass in this station in Egypt, the only one who was able to let the child sing. He just did it when he just catch her hand and start to lean on both sides with her and start to dance with her. That's why she was a little bit shy, and when he do that, she start to sing. Usually they are accustomed to do that in the nursery or in the daycare with other children, catching each other's hand and start to sing together. After doing that, could you tell me a story? Many children who are able to tell a story, sometimes they are shy and cannot. But if he did not, this means he's not able to. He may be just shy. That's why try to encourage, not yet. So I have something here I will keep in pocket. I will keep in my mind, this is not done yet. Okay, let's count together. Okay, 1, 2, and stop. Okay, count to 10. Are you able to? Oh, that's great. Let's say 1. What next? 2, 3, 7, 8. This means after 3, he starts to skip some numbers. Now the age is 3. But if he's able to count to 10, and even know letters, and he can tell alphabet, the more we give, the more we are around 4 and 5. So count to 10. In the colors, at the age of 3, he's able to know 2 basic colors, and at the age of 4, he's able to know 4 basic colors, and at the age of 5, he almost know most of the basic colors. We show you the last time that from the internet, this is that we are saying there are some variations in ages and numbers, but the most important to seem confident about what you are doing. And then in the word sentence, you can just ask him what you are doing when you just get up from the bed. So if he can say that, yeah, I get up and then go to the bathroom and brush my teeth. So this means he can tell 4 or 5 word sentence. But just go to the bathroom, so you consider this is like a 3-word sentence. But sometimes if he's not, okay, I have many things which is kept, especially this area, colors and words. So colors and words and the story, I can just keep it in a pocket and my pocket, and I say I will keep it to the end. If I cannot invite him, I have alternative way. I have another strategy. Okay. Now we need to move to the nouns and verbs. Let's start because what I'm saying, not to do this now because there are many things which is more important than this, and we don't want to waste the time. If he said it, that's okay. If he did not, please spare it to the end. Okay, okay. So the child even not get bored. You ask him many questions: name, age, sex, then sing a song, tell a story. Let's count all of this till now can be tolerated. You ask about the colors, yes or no. If you just feel that the child is not willing to talk or this is not appropriate way, what the color that, what color that. So keep it till the end. We will do it in a more brilliant way. Here, nouns and verbs. You just go there, bring the three toys we said. And the three toys we said just to put one spoon, one car, one lion, and start to ask him, okay, now, where is the car? Where's the lion? If he just use it or point to it, this means he know nouns. So cars, nouns, things like that. Usually this is from the age of 18 months to the age of 24, but even he can know the mother at earlier age. So mother and father only, where is mom, where is dad, he can know at the age of 1.5 years. But other nouns like car, like lion, like things, this is mostly at the age of 2. So now he know nouns, where is the car? But if you ask him, what we are driving, which one we are driving. So now I'm talking about driving, the verb. It's the same, but which one we are using to feed ourselves. If you just point to the spoon, this means he understands the verbs. Eating. Okay, so now I'm talking about nouns, verbs. Then we have here nouns and verbs. This is looks like very important for us. It is looks like two-way, which way I will go. If the child is able to know nouns and verbs, and this is a brilliant strategy, just to be a little bit organized. Nouns and verbs, if he knew it, so this means he's 2 years. I need to go step up. So I will ask about preposition. This is a strategy. I don't have to make it in the same sequence, but I need just to keep it in my mind. So nouns and verbs. If he knew it, go up. Ask for preposition. So could you take the lion under the table? Okay. Could you put the cube over the car? So under, blue, uh, behind, in front of, all of these are prepositions. So prepositions in Arabic ظرف المكان. So very important. If he can do so, this means he's age 3, and we have a habit. Once he's able to do a step, I need to go further up, further up. So never stop. But if he is not able to do prepositions, that's why I need to say, what is the strategy now? I need to confirm, is he's able to do prepositions, but not more than this. This means the child age is almost around 3. Now I have nouns and verbs. He know nouns and verbs, and I asked him about preposition. He did not do it. What I will do? So now for me looks like he's not 3 years. I need to confirm now. So I will ask him, okay, what is written here? Could you put the cube on the cup and give it to mom? This is two-step order. Okay, could you put the cube on the car or put the cube on the cup and give it to mom and get the line from her? This is three-step orders. Every time I'm confirming. So if he's not able to do that, so this means he's still in the area of 2 years. Two-step orders. Nouns and verbs. If he's not from the start, I have two possibilities now. He knows three possibilities in the nouns and verbs. He know how to say noun and verbs. This means he's 2 years. So I will try the step orders. I will confirm that he's almost 2 years. Then I will try prepositions just to make sure that he may be 2.5. We said we have a pillar. We have a central pillar, عمود الميزان. This is in the middle. We need to know now our central pillar is going around the age of 2. But I need to confirm every time. Sometimes he may do 3 or 4 tasks at this age and one at the age of 3 years, that's why I will give him 2.5. That's why you need every time to try to go up, try to go up. Even if your child is only 2 years and you are comfortable that he's 2 years, never stop. Always try to go up to make sure that he may have one outside of your central tendency. Now he did two-step orders, and I will ask him to do prepositions he's not able to, and that's why the first possibility, this one is 2 years and everything is homogeneous around this age. The other possibility, yeah, he can go up a little bit in anywhere in prepositions, but again, return to the central tendency. This means I will give him a little bit 2.5. But if he do nouns and verbs and he do prepositions, I need to just make sure that he's not bigger than 3. So, okay, now which one is bigger? You bring a small cube and large one. Which one is bigger? Okay, big and bigger, smaller and smaller. Which one is this is the comparatives. And usually comparatives is done at the age of 4. And we are in the day or we are in the night, opposites, hot or cold. This means opposites, hot, cold, day, night. If he just know that, this means he's 5-year-old. So I will never stop. You know preposition, try comparatives. You know comparatives, try opposites. There are many things written in this area, but this is now looks like an agreement, because those ways it is just an agreement between examiners. This is now you test many areas on your child and you have many things to do just to do that, and you will see yourself now many mark sheets, many things are written, and the candidate even did not do half of it and he got clear pass. You have a strategy, you have a way, you know the expressive, you know the receptive, and this means that very important that you are a good guy, and although you did not do anything, it is called focused exam. You cannot do everything in 5 minutes. So this is now the things which can fit to the time we got. Okay, so don't bother yourself with many details. This is, believe me, those all what you need. Okay, now if the child does not know even nouns and verbs, so I will run to body parts. Okay, so very important. Body parts mean he's maybe 1.5, maybe 2 years around this age. So if he just pointed to 3 body parts, this means he's 1.5. 5 body parts, he's hardly 2 years. Now we are covering, you see, in the first year there are nothing much more to be done or said. It is empty area. All the explosion of the hearing and speech comes at the age of 2 and 3 years. That's why usually if you have a child autism, this is the peak age of incidence to pick at the age of 3, because the explosion of the speech is at this age. Okay. Here, returning back to what we get. We have a strategy. Some guys say, okay, what is the meaning of expressive? What is the meaning of receptive? Just imagine you have a child with intact hearing, and he can follow you in many things, but he's aphasic for any reason. So selective problem to the eighth nerve, or selective problem in the pathway to the larynx, problem in the larynx itself, anatomical one. Just imagine we have two things, efferent and afferent. This is regarding hearing. So the afferent is intact, but the efferent, there is a problem. So he can understand and he can hear you, but he cannot express because there is efferent problem. You got this? So when you ask this child, what's your name? He will just, so air, nothing, or just with the language, with the sign language. This means he understands you, but he cannot express. That's why we are calling this is expressive aphasia. You can isolate this when you ask the child, where is the lion, and he got it for you. This means he can hear you. Now he's just In this area, there is no sound. You see, where is mommy? Where is the one we are using? Put on and give it to mom, and then put it under, put it over, put it behind, and this is yours or mine. This is here, no voice, and all of this here, everything here, mostly no voice. That's why this is now you are testing the receptive, but here you are inviting him to talk. What is your name? What's your age? What's your sex? Can you sing? Can you tell a story? Count to basic color, two-word sentence. This is you are inviting him to talk. So any child has only efferent problem. He will be able to hear you. So receptive will be nice, but expressive will be no. He has expressive aphasia. Okay, I have one like that. He was Down syndrome, and receptive, very nice, expressive, zero. He has expressive aphasia. Those cases are exam cases. That's why you need to know what is meant by expressive. The expressive means he's able to tell expression. He can express himself. He can tell sentences, words. Okay, that's why if it is here, this one is not working, this does not necessarily mean that also receptive is affected. That's why I need to put in my mind, I have two limbs, one afferent, one efferent. Now we are talking about the efferent. This one needs the integrity of two. If he's able to do some parts of it, this means the circuit is working, because this is the end part of the circuit. Okay, but we are starting with, because if you just start to give the child toys, you will not be able to talk to him then. That's why you start with talk little bit. If you just feel the child get bored, skip here and say, I have another backup to do the missed things, which is the story, which is the two basic color, the word sentence. I will just, now I have only few words, nouns and verbs in the middle, and I have body parts here in this area and the preposition. This is my plan. If he's no nouns and verbs, I will try to go up. If he does not know, I will go down. Please point to your body parts. This is the summary. Okay, okay, very nice. I think here we explain it in a very nice way, and we get a plan. What is the backup? We said we have a backup for such things. Now you can bring a print, fine print, or a story, or anything which contain figures, and start to tell the child, what color is that? So you see this jacket, yeah, what color is that? So now you can get the colors on the story. Okay, okay, and then you can ask him, oh, you see the cat, what she's doing? And now you are inviting him to talk. He can tell the cat is running after the dog. This is four-word sentence. You got it? Because sometimes I can ask the child what are the things you are doing after getting up or walking or just wake up. He may not understand this, but when you just bring him a toy or a story and ask him, please, could you say cat what she's doing? She's running. She's running from the dog, or she's running after the dog. Anyway, now you are inviting him to talk in the language he's able to tell. Okay, so just don't spend much time on it, and just make sure that now I have the exam is 4 parts. Number 1, test. Number 2, talk. Number 3, play. That's what you see. And number 4, the backup, which is the story. And the book, using the book or fine print to invite him to test for colors, to test for the story, to test for the word sentence. Very nice now. And as you see, if I just spared all these things, all what will be there? Just what's your name, boy or girl? Okay, let's tell a story. No. Okay, let's count. And after that, you try with this. No, you will run. This means you can finish all of this in only 1 minute. And then start to play and spend the time on playing. And don't forget, I have backup, which is the story. Here, the developmental history, just a little bit revision. Again, we are talking about inviting the mother to asking about the concern or the complaint, and we get some feedback. It is not like that. Somebody in UK is just going ask the mother about the pregnancy start point, and then they get the story from zero. For me, and I insisted that this is does not look logic. Or for me, I say, yeah, you might get it, but maybe weird, little bit. Maybe the examiner don't like it, but at least at the end you got all what supposed you got. That's why it's okay as long as you get what we need. It's okay. But any encounter, any clinical encounter, should start with why you are here today. What is your main concern? Okay. Before I start to ask and start and make it a questionnaire, and this is an art. Invite the mother to talk. She made, and now we are saying, and this is, by the way, written in the art of history taking. We have many looks like advanced sources, and it is really sophisticated little bit. But they are saying the art of history taking depend on that. The golden minute. The golden minute is just invite the mother to talk and keep silent for the 1 minute. She will tell most of the story, and after that, fill the spaces. Only ask about the things which narrow the differential. And in this way, we can get it very easily. Just ask the mother, what is your main concern about your child development? They say, yeah, he has hearing problem. Okay, could you tell me more about that? When you first noticed this issue? And she will start to talk, this is since birth, when he was like that. And if she said since birth, we say by time, by the time. Okay, since birth. And let's take it from the start now. So your pregnancy was okay. You are not using drugs. You are not taking any medicine or anything. All gel scans are okay. Yeah. And what about the delivery? And let's finish this issue because it starts since birth. But if it just noticed he's 3 years old and you just noticed at the age of 2, okay, so you need to take the story first. So what happened? And what happened at this time to make you take care or notice that? I'm thinking about triggers. So does he have any fever? Was he okay? Before that, he was completely okay. So what happened for him? Okay, may he have meningitis and cause this and causing him hearing loss or hearing problem. Extremely important. In Egypt exam, the child has kernicterus. That's why now, if I just know when you first notice that, this means I'm going step back. But it's really very important to invite the mother to talk, and this is art of history taking. And this is nothing to hide. I'm talking to the mother. So no restrictions, no questions is forbidden. Okay, so somebody say that I will turn around to make it. Why? If there is easy way and shortcut and direct to the point, why turning around? Just to go directly to the mother, ask her what is your main concern. And this is done in Egypt exam, and it was very nice. We said usually we are following the advices of the senior. And here we said this is the advice of one of the senior examiners to say, yeah, start with the concern, and then after that, take it by logic sequence. I see this is a brilliant way, and that's why we said again, then the child, the family, and the social in the middle, and that's why the 4 areas of the society. Just running, we are talking about the concern, when it happens, what is the story. Don't go in deep and just say what make it more, what make it worse, what. No, just make it like a story. It is focused history. So ask the mother, say, we have this, he has hearing problem. When this first noticed that, and she said, since birth, what happened for him? He was okay. And then you start to take the full story. So we have step back, and the step back, we have 2 packs. And step here, step forward, and what have been done for that, and what is the response for that. So what you do, just to say, child has hearing problem, and she say we go to the hearing doctor, and he just do hearing test. What is this, and what he told you about the results. Okay, and after that, did he give him anything or offer anything? Are you using anything? Offer just to go explore the issue now. And now, what therapy he's using? He uses speech and language therapy. So make it all what is the intervention done here. So it looks like a story, and this is the easiest way to take a history ever. Even in the history, taking the station itself, the most, and this is what we are training on to make it a story. And we said good history extractor does not talk too much. He just give one word, two words, and let the other one talk. And then, and what you did, what do you do for that? Okay. And before that, he was okay. You say just one word. And then, what after that? What they told you, and what they did for him, what treatment he's taking. This is all our open question, and you are inviting the mother. Please continue. Go on, please. Then you will go take it from the 0 point, prenatal, natal, postnatal, developmental four aspects, as we said before, and the hospital. If anything done here, it's okay. You may get it from as a story. So now you know we have a child who has, we said connectors could be child with meningitis or any trauma, any head trauma or anything. You may find your clues, and they are like to play in this issue. Child with road traffic accident that may affect the head, may cause him problem. Please don't miss any part of this. Child with cystic fibrosis or child with primary ciliary dyskinesia. That's why you need to ask the mother. He has a hearing problem. Hearing problem. That's why if you just said, and before that he was okay, he's not suffering of anything. Now, just to tell me, the mother can hide. No. So he was okay. He does not have anything. He's not suffering from anything. No, he has primary ciliary dyskinesia, or he has any problem. So what you do for that? And don't forget to say about primary ciliary dyskinesia. And did you do heart scan? So if the mother told we did 1, 2, 3, 4, it's okay. If she did not tell, fill the space. There is still area you need to fill. He may be cartogenous. Okay, that's why you are extractor, inviting the mother to talk. Make it as a story, and you will never lose anything. Okay, now I just make sure that the child has a problem and when it started and what the circumstances surrounding this issue. What is the reason? What are the triggers? Does he have fever? Does he have any problem? Is he, and before that he was okay? And when you discover that, what happened? what what happened at this area for him to be diagnosed. So yeah, he's admitted to the hospital. He has a rash, he has a fever, and he's admitted for almost 2 weeks, and they are giving antibiotics, and they take a sample from the back of the child. They consider, and what they told you, they told you a specific diagnosis. As they say, meningitis. That's it. You see, make it as a story and continue in a time fashion. Extremely helpful. This is, we are just gonna jump prenatal, natal, postnatal, and the developmental four aspects. It is called the neurodevelopmental history. And again, we need to make a way and make our way. We need to practice on that, and we need to train ourselves to take a history. Not everything known is told. So you need to know that, because you may have a child who's younger than 1 year. This is extremely rare overseas, but very common in UK. You need to know all of this, because it is just imagine they are bringing one child for you, Down syndrome, 1.5 year. Please examine his fine motor, or please examine his gross motor. So if you don't know that, it will be really a problem. Fine motor, just fix and follow, reach for objects, transfer objects, and we just bring the things which looks like 3, 6, 9, 12. Okay, easy. Okay, now easy. And again, in the gross motor, we just put a mnemonic. We said best walk, and this, I think, very easy now. Ball to sit, prone to supine, then sit at the edge of set. And here we have two sets, sit with support and sit without support. Then pivots and creeps at the age of 9, stands at the age of 10, first walk at the age of 12, and limit age is 18. Here we are talking this issue. You can just, if it is not relevant or the child age is too far, like 3 years old, and your task is please examine this patient gross motor, or let's say fine motor. So not to spend too much time, Do you remember when he was first set? Yeah, at the age of 6. This means, yeah, he's developmentally okay. He's not delayed. No, now he just set at the age of 1 year. And you remember when he was first stance, first walk, yeah, and you find that there is delay. Then now what he's able to do, run, jump, hop, what about playing football? Or is he able to ride a tricycle? You see, now I ask it more than 3 or 4 questions in a time fashion. This means I need to skip some. And I can ask one open question, what he's able to do now. Okay, so he can run, he can jump, she will tell. And this will spare the time. So I will take only one here, sit, stand, walk. This is very easy. Sit, stand, walk, or I can make it even sit and walk. That's it. And then what he's able to do now. I told you, if we just put it in a time fashion, the story in 30 seconds, natal, natal, postnatal, all, we have 3 screening questions in another 30 seconds. Then it will be 1 minute. I have 4 developmental areas. If we just go a little bit here in this area. So again, till here we have only 1 minute left. Then in this the core team or the hospital, we are trained to make it in 1 minute. Is there any history of any major illness? Has any surgery? Is he admitted to the hospital for a reason? Trauma? Which team is following with? Is he taking any medications? What about the shots? All we are trained to make it in 1 minute. So 1 minute before, 1 minute after. If we just say here we have 4 aspects and we will give 30 seconds for each aspect, and this looks like a time limit now. So I cannot exceed more than 30, 40 seconds. This means I will cover the 4 aspects in 2 minutes. If I just ask about first sit, first walk, and what he's able to do now, what do you think? I think it will cover everything and we will make it in a time fashion in a 30 seconds. You need to be smart, you need to be pianist, and the pianist is not pressing all the keys at the same time. You need to know when to press it more deep and when to just touch and run. But this is called developmental history and you cannot escape this issue. You cannot skip this issue. You cannot just defer it or miss it because it is neurodevelopmental history. You need to tell the examiner, I am caring about aspects of development. Okay. Now we talk about the receptive hearing, about startles, still to the mother sound, understand pi and no, turn head to noise, and 9 months enjoy rhymes and respond to all name. And expressive about pupils and words, that's it. Pupils, mono at 6, poly at the 9, words, 3 words with meaning at the age of 1, 6 words with meaning at the age of 1.5. Very easy. Expressive, this is social. 6 weeks, social smile, 6 months, sorry, the title is not true, it is about social. 6 months mouthing of objects, and again 9 months peekaboo, strangers anxiety, and 12 months pie and hand clapping. We put a way to make it easy, 2 by mouth, 2 higher functions of the brain, and 2 by hand. In the hospital, we talk about COAT, C-O-A-T, COAT, immunization and allergies. We will just skip allergies for the sake of the time, and it is not related to the issue. So now it is chronic illness. We said it is that. Family history, only 2 words, pedigree and illnesses. And especially, do you have any problem if you have children? So regarding the development, they are okay. So no problems in that. Do you have any child with a problem in the development? You need to be specific in this area. And social, we said that looks like child in the center of the care, family surrounding the child, and the society is surrounding both of them. Here we have the money support from the social service, and we have the emotional support from camps, and we have educational support, and we have NHS support like health visitor or worker service or respite care or anything like that. This is all areas of the society, and now we can make it brilliantly if you just know this picture and where the here emotion, money, emotions, then education, then health, you will do it perfectly. So that's why I'm asking, do you work? No. Your child work? Your husband work? Yes. Do you have any financial problem? No. Are you in any income support? No. I finished the first part, even without memorizing. Okay. Do you have any problems in the family, like divorce? The father is caring about him. He's attending the clinic. He's coming with you. No, he's not. I'm alone. I am divorced, single mother, anything like that. So once she said like that, how can you cope with his illness? How do you feel about his illness? Okay, doctor, it's okay for me. I can cope easily with that. Or no, really, it is a burden for me and I feel unhappy or restricted. So now I pick something from the history to put in the management plan. If for the child, I need to talk about cognitive behavioral therapy, educational psychologists, psychiatrists, support groups, and in the family, I'm talking about educational psychologists and support groups. Education, again, that's why. After finishing that, you need to just run to the education. Okay, what about the school? Is he in any school? If she said yes, what the type of the school? Mainstream or special needs school? No, he's not in the school yet. He's only 3 years old. So are you educating him or learning him by any way, like any equipment, iPad? Does anyone do any training by play or play specialist play education? No. What about portage? Anyone visiting you for the sake of education? No. So I'm talking about all what is education. But let's say he's in the mainstream school. Now I need to know if he's in mainstream school, I need to know the relation and the role of everyone in the school. Nurse, doctor, peers. So are they helpful or are they adding to the child problem? So they know and they know how to deal with them. Okay, yes, that's great. What about the Cinco? She knows, yeah, and what she did for him, she's helping him in a good way, yes. What about the peers? Are he bullied? Are he exposed to any troubles? Do he like to go there? What is the relation to the peers? Very, very important. Now I can make even in a sequence without need of memorizing. And after that, going to the health service about, especially this is done in, if you see a child is quadriplegic or a child with special need, what the health visitor, worker service, and respite care. To complete my exam, I'd like to assess other aspects of development and then the CVV. We said the HCVV even provides the patient's red book and the medical record, plotting the centiles, checking the vitals. So this is not related, that's why we are putting in gray, sorry, and relevant system like eye, hearing, neuro. You have a child with Down syndrome, any of the famous syndrome like Down, Turner, Noonan, all of them has three: eye, hearing, and even the mouth has problem in the three areas of the face. So this is very common. You need to offer that. I need to do formal eye assessment, hearing assessment, do neurological exam according to your case. You need to select the other system. This is really great importance. You have 9 minutes. Take your time. Speak in a good way. Try to act in a good way. Give a clear message. Don't be in a hurry. 9 minutes is too much. 9 minutes is too much. That's why please try to be logic and reasonable. Don't be in a hurry. Uh, we told you that, and this is, by the way, the exam way. One of your colleagues, she just told me that. I go to the exam. I found him. Looks like a very famous one, and he's very, very senior examiner, and he's wearing a very nice suit and looks like using perfume. And he looks for me in a good position. And then I was just shy to tell him trivials like vitals, and he looks like this is I don't want to waste his time. And what we are saying, this man is wearing this suit and bought this perfume to come to you and hear this trivia. So please make it in a logic sequence. Know your rule and know what is expected to come from you. You are a resident, so this is a problem if one is working in a subspecialty or he's a consultant or anything. You need to go down to the level of the exam. Go down to the level of the exam to say, I will do what is assigned for me and what's supposed for me to do. So I'm a resident, I will take history, and after the history, I will do exam, focused one, I will check the centiles, I will check the vitals, I will offer to do other areas of assessment, and after that, if the patient needs initial investigation, I may ask for, if the patient needs invitation of other members, I will do it. This is my job. Okay, I need to discuss the case with senior before inviting other specialists. This is extremely important, so I will discuss the case with the senior first, and then we will invite the members of MDT. Okay, they like this way. So don't consider, again, this is the exam way, and please make it in a logic sequence. We are taking history, and after history, we are doing the exam, and after the exam, we may ask for some investigation. In the exam itself, we are looking for centiles, for vitals, and then do physical exam, and then may ask for investigation, then discuss it with the senior. Here, we finished the approach. We are now about to talk about recall and presentation. How to present a case like that. Again, tell your first impression. So she's well looking. I think this area, nobody will tell you that, only the positive finding. It is 9 minutes. So you can just say Lean is a well looking girl, features of Down syndrome, wearing glasses, phrases of hearing, speech, and language, chronological age of 6 years, and then developmental age. You need to divide it. I test her, she looks like grossly she can hear, expressive language at the age of, receptive language at the age of. So, or the patient has expressive aphasia or dysphasia, and they are using these words interchangeably. So aphasia means dysphasia. We searched it for, and we found that they are using any of them. But if, for me, better if he's no words at all to say aphasia. So he has expressive aphasia and secondary to receptive one. So both areas are affected. Very important. Or expressive age, so she gave the age of, and the receptive, she's at the age of. And then to complete my exam, if you did not do it before, do it again here. You have a backup. Train yourself to do it over 30 seconds, and please download a recording app and train yourself on that. This is really the best advice. If you have only 1 month remaining to the exam, the best thing to do is just to go put a list for every branch cases and start to imagine it and record it. If you can present it in a systematic way, this means your brain is organized and you will do the exam in the same sequence. Sometimes when I'm presenting, and this happened many times, I'm presenting a case of respiratory, and when I'm here the recording, oh my gosh, I forget to mention the RR. And then repeat again, I forget to mention the RR. When you are forgetting to tell here, you will forget to do it. But now I'm stressing to my mind that please don't forget, RR is very important in respiratory case. So please don't forget it. This means I'm organizing my head and I'm organizing the way I'm gonna present the case. Very, very important and very keen advice. Try to imagine the cases and go present it and listen to it and see areas for development. Here we said to complete my exam, still remain the discussion, and we said this is here the rapport communication style. You will see now one of the examiners, even before the new mark sheet, just to say, you kept silent. You kept silent. This is bad thing. So you need to talk to the child, play with the child, enjoy with the child. Your style, how you look. Really, if your style is okay, we saw it 100 times. If your style is okay, trivial mistakes can be overlooked. But if your style is not okay and the examiner does not like you, he may bring very trivial one and put it beside another one and put another word like any word like you are not keen to the child, you cannot engage the child, and then after it down it, You forget to ask about anything which is very trivial, can be overlooked, and put another reason. Now, no one can appeal, no one can just object on that. So they have the power, they have the way. If he like you, he can, yeah, despite you dead, but overall you're nice, I like your way, you're welcome to UK. We are stressing now on the robust and the style. Uh, this is what I'm seeing myself when I do mentor physically and individually. Some of your colleagues, they kept silent. You know why silent? Because we said when you are learning driving, you are overwhelmed with the details. But 2 months after learning, you forget all the details in the car and you concentrate on the road. You go silent there because there are many details. You're afraid to forget this and you're afraid to do that and you're afraid. So you are overwhelmed with the details. But if you reach the level of the habit, you will forget all of this and concentrate on the target, which is the child, because you do it by heart. You are not afraid to miss what is that, what is this, what I should do. All of this, you are higher more than this level. Then physical exam and information gathering and identification of clinical sign. 8 marks in pocket supposed to be before even you open your mouth. Just to talk in a nice way and be organized and be trained and be ready. This is, I say it 100 and no harm to say it 101. This exam differentiate between ready and not ready. No relation to smart and poor. So if you are ready, you expect everything and you are ready for everything. So clinical reasoning, give a reason for everything. So I give the child 2.5 years. What are your reasons? Because he did 1, 2, 3, 4, and he did one at the age of 3. That's why I give him. It seems like you have a reason. This is the meaning of clinical reasoning. You are picking and interpreting and put in hand. What do you think is the cause of delay? I noted that the child has a squint and he's Down syndrome, and I think this is 2 factors which may add to the delay. Another factor could be lack of training or lack of education. You see, brilliant. This is a brilliant way. I needed to be ready. All questions are there and all answers should be ready. There are no place for just thinking. And if you, for me, most of the answers are melodies. It is just blocks and you're just going there and make the show. Then you go there and talk about management plan. What is remaining? It is MP just. You just again sing and sing. Everything is ready. Everything is known. Nothing out of prediction. Discussion will take 9 minutes. Who is that? 3 questions. Major question will be there. History, cause of delay, investigation, MB, management plan. It is about CDT, and we talk about that. We are not going to repeat this. Causes of delay, beef, and investigation of the developmental delay. Again, if the child is okay, no investigation, reassurance, and follow-up. And if the child is delayed, so should be tailored by history and physical exam, no routine investigation. The thing you need to just take about the medical, then paramedical, then genetic education support, and then the last one is community pediatrician to join them all. Community pediatrician is a branch in UK which is not available in our country. It is looks like the one who takes care everything about the child. He looks like an orchestra leader. In the opera, you'll find someone who's just harmonize and just to press you now and you there, and after finishing the you, I will send her to another one. So he's the one who connect everything. He makes a plan for the child. This is called community pediatrician. So now your main problem, I need to make hearing assessment. Go make hearing assessment. After that, I will send you to do eye assessment. You need to be seen by neurologist. I need to send you now to child developmental center. Or so the one who orchestrate or harmonize everything is the community pediatrician. So we would just run this because you got the melody already one time. Now we are finished about hearing, speech, and language. Let's move to the social. Social, one of the straightforward and very easy part of the exam. Uh, just if you know it and know how to do it, really it is in hand. Because no much things to be done there. Social, very easy one. All what is needed is just to be prime. And let's prime together. In the social, you have two possibilities: either uncooperative child, and in this way you will play and play and play and play, and you can mix that with question, but this now no more available, either play or ask. So you need to play, 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 try everything, and to try to make everything. In such situation, we have one case in Jeddah, and the candidate go there, and he just did try hard to engage the child. 3 minutes, 4 minutes, he's trying. The child is not responding. He's finished everything with the child, and after that, he go talk to the mother, and he get the clear pass. This is in the old way. Again, you may take your time just to go, try to invite, be calm, and be inviting, talk to him, try to make things closer to him, offer, we will see the way now. And you have a cooperative child, and this cooperative child, you play then again the question. Social cases could be autistic, could be ADHD, could be neuro, could be syndromes like Down, like William. William, very common to be assessed in the social area. So autistic, they are advanced in the social area, and that's why you may find case of William syndrome very common to be asked to do social behavior. Uncooperative child. You will do the same sequence and bring the same tools, feeding tools, line, dull, car. All cognitive, same things. And then uncooperative child. We have only one page. It is only one page. You need to know it by heart. And please, this joint attention, remove it. It is not the right place. So please here remove the joint attention. Just forget about. We have uncooperative child. It is only one page, and we intend to make it looks different, to just again use your flash memory. I will really in the exam, you will remember by the site. So social first, and there are only 4 words: aloof, no emotional response, social sharing, and tantrum. And then in communication, you will remember here question, here what, here what, here what, and then you will know the places. That's why we intend to make the page different, just to take the advantage of flash memory. Your flash memory, you will know that this word was in the right side, the bottom of the page, and you need to, that's why we ask you to revise the 4 pages. It is development only 4 pages, which is 4 tables. If you have the ability to revise them at least twice weekly, it will be brilliant. At least. Some people are revising them in the last month every day with the coffee, or while you are driving your car going to the hospital. You can just make it like every day. I'm saying in the age of that, you will be able to do 1, 2, 3, 4 at the age of that. So now the everything is clear in my mind. One by one. Social, you go there, you will find the child is aloof. Aloof, you observe that he's alone, he's just sitting, he's uncooperative, just sitting, not responding, not talking, not joining, or just wandering or cruising the place without joining anyone. So he's aloof, and this is by notice. And no, you go down, just no social sharing. You bring him some toys, you have some toys. Okay, let's try. What is that? Do you like that? You see this car? Here we have autism, especially, or uncooperative child. Most of them has a favorite toy. If he can just catch it, he will not never look at anything else. So that's what mean if you may offer him a lion and he's not interested in the lion, so he will not take it. So please try another one. What about the car? What about the doll? What about a cube? What about anything? Spoon, cooking, try everything. So don't get desperate. Don't get bored easily. So try till you find the most favorable one. You can ask the mother, is he have any favorable toy? This is, you cannot do autism without the share of the mother. You will, sure, you will have the mother every time there are mothers around. Does he have any favorite toy? If at least you did everything and you cannot reach the favorite one, ask the mother about. She said yes, like that, go and bring it and give it to him. Then he catches the toy. You have a time, and we said this, especially this station, ends easily, does not consume time. So what you are saying, try everything. So now you are just giving him, and he catch it now. He get his favorite one. Okay, try the social sharing. What about taking the car and give me the line? No. This means no social sharing. Give me and take. Okay, all of these are not there. Okay, what about give me that and take that? No, this means no social sharing. And then you go to do a movie to say this is you just give him any toy, and while you are taking your arm back, just hit your arm on the table and say, ah, you see, I hurt myself. I hurt myself. Oh, it hurts. Then you will find no emotional response at all. He's not caring of you. He's not looking at you. Usually, if any normal child, he will just you'll see that he may get sad or even cry for you. Even you just to say, "Oh, it hurts," like that, and started to make the movie that it hurts. This one, no emotional response. Regarding the emotional response, this is one way to ask about to do it, and the other way to ask the mother when you just try to play with him or just finger his is he getting ticklish or enjoy that when you just try to play with him and raise him or play him with anyway, is he enjoying that? No. So this we are talking about emotional response. Then tantrums, never try to do tantrums in the exam, but these are the four aspects of the social. It is not only about tantrum, it is all about the social behavior or relation to others. Is he got tantrums easily? So he gets explosive, he gets angry easily, or sometimes he's aggressive and hitting and kicking, or does he have self-injurious behavior? So he's eating himself or cutting himself or banging head against the wall. So this is self-injurious behavior. Or even sometimes they have odd behavior regarding, we said aggression, we say self-injurious, we say tantrums. This is the most important three in the social area. So now I will not never test all that. And you're gonna ask the mother, does he have a favorite toy? Yeah. What if you try to take it from him? No, I never. I cannot. If I do, he will get angry and cry and start to shout. So this is usually the inducer for tantrums. We finished the first area, which is the socio. Then the verbal communication. And we said again, guys, this is, we have in the diagnosis of autism, we have a scale. It is diagnosed by scales, no single investigation to search for. So if the examiner asks you what are the diagnostic investigations, uh, some guy is, we can ask mom all this question. You again, you again, you never give up. Okay, Dr. Faisal. Okay, keep it to that. Just to take a look. Who's Abbott? Okay, that's great. Now we are moving. We said that there are no investigation to diagnose autism. Diagnosis of autism depends on using autism scales. This depends on observation and the questionnaire to be asked for the mother. So you are merging both observation to history. And regarding the regarding the exam, we have many rules. One of them, do what you can, ask about what you can't. So we said, what you can do, let off. That's why what you need to ask is too much. And what I'm saying, just the 3-4 minutes and then run to the mother, take, do because in here you got all what you need by just observation. It will not take time. In the area of question, we said this is the summary. We say if we just get this paper, it is just organized of one of the rating scales. It is called CARS. CARS stands for Childhood Autism Rating Scale. It is very famous and uh, recent one. We have many types. We have I think like chat. Chat. This is very old from 1990s. Too old or something like that. So chat is old. CARS is one of the recent scales, and we have MChat, modified chat. So we will see the abbreviations after that. But what we are saying you, this really are the items of the CARS. CARS is Childhood Autism Rating Scale. But it is organized just to help you to memorize number one and to do it in, you just divide all what is related to social in the social, what is related to communication in the communication. So now it is more organized. And it helps you to you have a strategy to do it in the exam. So I will start to observe, try to engage, offer him a toy, mini toys, and then I will try social sharing and then search for emotional response. Run. Now I will ask the area of question. So do you like the car? Okay, now what's your name? Can you tell me your name? What is the name of that? He's not answering. And instead, you may have the child like has echolalia. Okay, let's play with the car, and he repeat the same words. Let's play with the car. This is echolalia, echo from echo. So echolalia repeating the same words. This is very important and very characteristic. It is one of the criteria. Then here, this is question, and either he has a good question or echolalia. By observation, you notice that even to the mom, there is no active conversation. It is not related to you. It is only by observation. That's why we say here, you observe he has no active conversation to anyone. And sometimes they have unrecognized words. Unrecognized words, this is, looks like he's speaking ununderstood language. So the language is just, or just to get, telling things which is, looks weird. It has a meaning, but we just to say unrecognized words. So either when you talk to him, either you found no answer at all or echolalia. And by observation, you may notice that there is no active conversation even with others, and there are, or maybe there are unrecognized words. In the nonverbal communication, no eye contact, no facial expressions, no pointing response. So no pointing response, this means when you, this is what is meant by the joint attention. When you point to something, okay, see here, what is here? Do you see the lamp? And you point with your finger to the lamp, he would never follow your finger. He will follow, he will never see the target, but he will just look at your finger. So this means is not able to, he has no attention to the joint, to the things you are pointing to. So no pointing response, no pointing responses. This is very important, and this you can do it. And the things which like you ask the mother how he, all of this I will get observed by myself. That's why in blue. But the one in yellow, I will ask the mother if he need anything, how he do that. So he point to or just to take your hand to it in the severe form of the non-operative one, non-cooperative one, you will find that no, he take my hand and lead me to the things which he needs. So he never point. So he never follow your pointing and he never point to things. I think now we finished verbal and the non-verbal. All what is remaining is rigid routine, stemming, obsessions, and type of play. It is all about behavior. So rigid routine, I can ask the mother about that, but stemming, I can notice in the exam, stemming means repetitive movement. stereotypic movement. So stimming like head banging or head nodding or just rock and roll, just banging or leaning from one side to another side or repetitive hand movement. All of these are called stimming. We need just don't write stereotypic movement. It is just I need you to only one word because I depend in your flash memory. This is the keywords. Rigid routine or rituals. You are asking the mother about when he wakes up. He do every day. He do the same things. Okay, does he have rituals or routines? This is very important. Yeah, every time he wake up, same toy, same corner, same steps, every time. This is rigid routine. About obsessions, I need to ask the mother about is he using has a favorite play again? Yeah. Okay, I got it from the first question. What about the car, his favorite one? Am I right? Yeah. Okay. Is he using it as a car or just to catch the wheel and to play with it? So obsessions mean concerning about the details. So he does not deal the toy as a toy. He just catch a part of it and become overwhelmed and interested only with the part of the toy. Then in the play, I need to talk about the type of the play. So play alone, play with other, watching them. If he just put in some in, between children or among the children, is he joining them? Is he watching them? Is he interested? Now I can see solitary or spectator. What is the type of play? Okay. Is he using again? We will have a very good way to just to know the types of play here. So I need to know pretend play, simple play. What are the type of play he's doing? We will do that now, and I will observe the gross motor. If he just get up and walk, and I can ask the mother. For me, looks like gross motor appropriate for age, or gross motor is hyperactive. Here, two situations completely different. If the child is appropriate for age, and usually autism, usually in the most of the cases, they find that they are sometimes they can be autism and hyperactive. So sometimes it is difficult to say, but this is not the exam cases. Exam cases because it is really a difficult situation if you are not primed. So they will bring a case. Usually there are cases which is not appropriate for the exam. Those cases extremely hyperactive. They will not never settle or has aggression or tantrums, things like that. So I need to ask myself appropriate for age. And now there are discrepancy between gross motor and cognition, and that's why it will make the diagnosis of autism more. Developmental history and rest of the social history. So I will take the history as usual, and please, you see, many. That's why here I'm stressing that half of the scale is a questionnaire, you see, and almost more than half, you need the input of the mother. So you need to come again and ask the mother, Aloof, I saw it. Social sharing, I will ask about how he deals with others. Giving, taking, responding, sharing, no. Emotional response, I will ask about. Then about tantrums, aggressive behavior, self-injurious behavior, all of this you see, I'm just depending on my flash memory. So many things depends on the mother. In the conversation, okay, I saw myself, all what is remaining for me, all of the conversation or communication, verbal one, I can pick it myself. And most of the non-verbal one, I can pick it apart from indicating needs, how he indicates needs. So in this area in the middle, I just have one thing to stress on how he indicates needs. In the behavior, too much question to be asked. Most of it, most of it, I may need to ask about. Extremely important because if you see just the cars scale, it is 15 questionnaire, and each one with 4 marks, starts from 1 to 4. So there is no 0, 1 to 4. And each part in the social we are giving this child now, his impairment is 1 or 4, and at the end, 15 items, and the score is 60. And we need to say this child no, low score and no possibility of being autistic, or there is no, he's close to 60, so he brings score 50 over 60, very high susceptibility to be autistic. You see, now this is the area we are talking about, the developmental, the cars. That's why all what we did in one of the here in overseas center, in uh, one of the conferences, or sorry, one of the training courses, the most senior guy gives them a paper consists of a 15 page and say, please just to try to memorize that. I have the paper now. I just keep it for the memory. And I swear, if you saw it, you would get shocked. So if I tried 100 times, I will never be able to memorize that. And even if you saw the cars scale, no one. That's why it is just a paper, true or right. True or wrong, and you need to keep the paper in your hand and just make it like 1 by 1. But in this way we did it. I think it is extremely achievable to pick it and remember it. And who did that? Really, it is marvelous, and he got the full mark. All what is remaining is just to have a good discussion and a good presentation and reasoning. So present yourself in a good way. Who did that? Really, it is marks in the pocket, because you did thing which is brilliant. Okay, returning back to the issue about, please don't forget you have many things you need to ask about in the social. If you don't have a chance about gross motor, if you notice that, that's okay. So you notice that he's walking, moving, jumping, climbing, things like that. It's okay. You can just, all what you notice you can skip for the sake of the time. Developmental history, as usual. To complete my exam, I'd like to, as usual, and then recall on the presentation as usual. Theoretical discussion, how to present a case of autism. It is really a challenge. You say your impression, then you have 5 phrases of uncooperative social. So the phrases is, here you need to tell the examiner, I observed, observation. The most important striking observation. You need to tell the examiner, I observed this, please use this word. Because here, most of your findings are observation. Okay, so please don't forget to tell the examiner. On entry, the most striking observation was that the child did not appear to notice that we are there, he does not have stranger anxiety, and the 4 aspects will take it 1 by 1. And you say, please, when I try to engage him, I observed or I noticed. So you see, please, I need you to use this word too much, because this is really what you do. All your finding depends on observation. So you need to say, I noticed 1, 2, 3, 4, and the mother gave history of 1, 2, 3, 4. And in the communication, I noticed 1, 2, 3, 4, and the mother gave history of 1, 2, 3, 4. In the behavior, again, the same way, and in the motor development, I noted that the child looks like appropriate for age regarding the motor development, and that's why the most likely diagnosis will be autism. To complete my exam, if you did not do it before, do it here. Discussion, the history, causes of delay, investigations, management plan, everything now in the melody area. Investigation, no routine investigation, the same, and we said diagnosis by the screening tools. We have CARS, we have checklist for autism in toddlers, and modified checklist for autism in toddlers, MCHAT, chat and MCHAT. There are many screening tools, but you must know at least 3 of them. That's why this is the most easy, because chat and MCHAT, they are almost same. And that's why here CARS, this is the most applicable and now widely used one, childhood autism rating scales. But there are many, and it depends on the area, and it depends on, even in UK, you may find 2 different cities, 2 different hospitals, each one has its own protocol. So you just need to know at least 3. This is and this is the most easiest one. So you need to know by name cars, chat, and mchat. He may ask you what is mchat. You say modified checklist for autism toddlers. Now this is the autism or uncooperative child. What if the child is cooperative? You will see now. I just added some videos for you. Very important examples we need to take care of. What about cooperative child? Here, cooperative child, again, you will gonna take the task, collect the toys in the same way, and you go same cognitive, all feeding tools lined up. And then we make a summary, which is brilliant one about what you need to do only in 3 words. He's cooperative. So you talk about feed yourself, feed the doll, talk to a dad using the car. This is all what you need to do. Cooperative child, it looks like, yeah, you make it easy. Yeah, it is easy. Just feed yourself. You will bring the feeding tools and put in front of him. Sometimes they may use biscuit or anything, or sometimes no, just empty. And he will make like he's pretending or role playing like he's eating from empty uh, feeding tools. So now you can observe what he's using. Is he able to, what type of toys, what type of spoon, fork, what is the things he's using? And this really, you can spend 1 minute on that or 1.5 minutes on feeding yourself. And then, okay, now, could you feed the doll? So feed the doll, if he did it, this means simple play. And now his age is 1.5 years. So feed the doll means simple play. Okay, then talk to dad using the car. You will catch the car yourself and you start to talk. Yeah, dad. Yeah, you need sir. Okay, 1 minute. She's with you now. Talk to that. Talk to that. And if she took the car from you and start the movie and start continue acting, this means this is pretend play. Pretend play is using a toy in another use. So now she's using a car like a telephone, or using a cube like a car, or using, for example, a car like an aeroplane. This is a pretend play. So now I'm inviting you. I have a very good plan now. Feed yourself, feed the doll, talk to dad using the car. Only 3 words. And after that, we will see feed yourself. 9 months, just hold and bites with hands. 1.5 use a spoon and drink from cup. 2.5 using fork. 3 spoon and fork. 4 knife and fork. You need to memorize that. There is no way. And make sure that the combinations or the complex starts from the age of 3. So even in any social area, all the complex tasks is done after the age of 3. You see here, this is important. So spoon and fork 3, knife and fork 4. This can make things easy. I have only 1.5, 2.5. So spoon, fork, that's it. So spoon 1.5, fork 2.5. Then playing, feeding the doll, talk to the dad in the car. We have a way. 1 year, we have 3 Ps. 3 Ps, which is pie pie, pata cake, and the peekaboo. So this is at the age of 1 year. Now, if I tell the child to just to feed yourself, and I noted that the age is almost no, she's only using the spoon 1.5, and she has no simple play. She may be younger than that. That's why I may need those 3 Ps. So wave bye bye, and let's play peekaboo. So you know how to play peekaboo. Just to put your hands in front of your, try to hide yourself, and we show you the picture for that. And if you just make yourself like peekaboo and suddenly appear, remove, spread your hands away, and you notice that the child is still waiting for you, and he know that you're still there despite you are away from his vision. This means he has object permanence and he's 1 year old. So this is peekaboo. Although not starting with a P, it starts with a P, but we just for the make it easy for you. So peekaboo and pata cake. Pata cake is a type of just clapping while you are singing. So bata cake, pick a man. So, and this is why they are clapping the hands while they are singing. So 1 year, 3 P's. 1.5 to 2, we have 3 S's. So number 1, solitary. Number 2, symbolic. Number 3, spectator. And this, from the name, take it one by one. So solitary means he play himself. And we have this more at the age of 1.5. He's not aware of the surrounding. If you have many other children, he's not aware of them. And he may have symbolic like feed the dog, but in the spectator, this is more to the age of 2. So spectator means watching other children, just like a spectator. مفتش. So spectator play. Then from age 2.5 to 3, we have 2P's, which is parallel and pretend. So parallel and pretend. So this means he did not reach 3 yet, because we said 1 to 3 means interactive play, imaginative play, all complex issues. So interactive and imaginative. What are the 2P's first? So one is parallel, means he just watch the children. They are playing with the cubes, so he will play the same toy, but not joining them. This means he's parallel to them. And the pretend, we said it, talk to father in a car. Then 3, interactive play. 3, this is we said now. Age of 3 is the age of complex, interactive play and imaginative play. So 3 to 4, you have associative play. Just he building a tower or building anything using a cube, and somebody is just cheering or giving. This is associative, but there is no common goal. There is no rule assignment. Just they are sharing. They help each other. That's it. But from 4, more than 4, they have cooperative play. Cooperative play means that there is a task, cups and rubbers, or someone, you just close your eyes and we will hide. This is all cooperative. There is rule assignment and there is a common task. And even imaginative play, one of them is a role play. Please write this. So role play usually from the age even of 3. Role play, he act like a doctor, so mother bring him a coat and a stethoscope and a needle and everything, and now he learned to act as a doctor or as a teacher. This is a role play. Role play, as we have in the exam. So you have one person, he's pretending that he's a father or he's a mother. This is a role play. So he make it like a full situation. Now the child is making himself or playing the role of a doctor or a teacher. This is a role play. And other imaginative way, they are using the tools like making a war or real cups and wrappers with toys like wireless and like communication, like using things like badges or guns or anything, using the toys in a real life situation. Okay, I think this is all types of play. This is easy now. And regarding dressing and undressing. So all undress, we put them together. So shoes and socks at the age of 1.5, undress alone at the age of 2.5, but not with buttons. And he unbutton at the age of 4. So 3 ages here. And in the dress, we have 3, 4, 5, with help at the age of 3, alone if helped with buttons. This is at the age of 4, and with buttons, he can do buttons at the age of 5. So if you think that your child is at the age of almost 2.5, and usually you cannot test for the dressing, or you can. Some guys say, and some senior examiners just say try, okay. And what you say? Can you take off your shoes and socks? Okay. What else? Can you remove the buttons so he's not 4? Okay. And then you can ask a mother. Do what you can. Ask what you can't. This is our way. Cooperative child. You have here in the playing, feeding, dressing, and the same in the history. You will take it again, playing, feeding, toilet, dressing. You know why? I will tell you. Here in the 1 year old, I may not the three P's, I can do it myself. But here, 1.5, there is a spectator play. Spectator play means I need other children to be there and I will need to see the child response, which is not applicable here. That's why I can do, yeah, solitary and symbolic, but I cannot do the spectator. Here, the same, parallel. I can do the pretend, but I cannot do the parallel. Associative, cooperative, imaginative, all of this, I cannot do it. Okay, so that's why I need to ask about. I need to ask about the things which is not applicable. So I don't have other children here. That's why I need to ask the mother about what if there are other children, what he's doing, just watching or play the same tool, but not joining, or he's playing with them. So now I need to know the type of play, everything in this way. So regarding the feed, I can just notice one thing, and I can ask the mother. So he just use the spoon just to make sure. No, but he's just shy. So the mother gave history that he's using the spoon and fork, or anything like that. So you need to take it again and ask about the things which is not applicable. So in the history, ask about playing, ask about feeding, toilets. How can I note that? So this is out of my hand. And we just put a mnemonic, just if you have a child, after playing, you just feed him and dress him, please, and go to make a toilet before we are going out. So it looks like he's playing all the time. Now we are planning to go out. So please eat, make a toilet. So after that, you will not bother us at the mall and just say, I want to, or Sensibri or anywhere, Ma, I want to go to the toilet. So do it here now, and please wear your clothes. We are going out. So this is now to make it like an easy way. Playing, feeding, toilet, dressing. History of playing. Are there other children in the station? No, that's why I need to again repeat everything myself. History of toilet and self-care. You just need to memorize. Okay, so just take it a screen capture and then memorize it. Because it's just what he's able to do. Is he dry by day, dry by night? Is he do toilet himself or things like that? History of dressing. If you cannot elicit in the exam, ask the mother about the history of dressing, undress and dress. Then presentation discussion as usual. Here we have the red flags to social, like poor eye contact, smiles, strangers, anxiety, object permanence. You may have someone who's just to say, when you consider referring any child to with social problem to a child developmental center. So this is now, if a child who has poor eye contact at the age of 4 weeks, this is the red flags. Development, 12 marks. There are no places for adventures. If you just collect such issues, it will be extremely not more than 30 pages. So even after getting the stressing on the importance of development, it is very, very limited and not too much to know. So please, no places for adventure, just to know the red flags. Even you can get it from the flower book of Mark Petit, the illustrative one. So at least get some. Okay, so don't go without. Red flags. Autism. This is classic autism.
You're gonna eat? Here, look, I have something to eat. Do you want something to eat?
On, no
Yep.
eye contact,
Okay.
no joining,
Here.
no caring, facial position, is not caring about anything, and looks like he's living in his own world.
That's yours. You can eat
I
it.
said this is really, it is not autism. It is better to be called autistic spectrum disorder. So it is a spectrum, means there are very severe cases and there are very mild cases. We see here spontaneous eye.
It has a.
He's just not fixing. There is no icon.
Kind of a sinus infection right now, so he's definitely not.
So this is very common type of autism.
A real sharp spike in self-injurious behavior this week,
and that's why it is a 4.
It's not been.
The problem is not from here. Here, severe ASD, you see. Yes, self-injurious just biting his hands and cracks, breaks, scars, bleeding. That's why she's wearing toxic. This is to protect her. She finished. She's crying. Then he's gonna fight. Okay, now. This can never be in the exam, but I have a message being that. So this is what we are calling self-injurious behavior. Okay. This is a girl continuously banging her head and shouting. This is another autism, severe one. Severe tantrum. Continuous crying.
Your favorite song?
She's putting her back over her head. You see, bang, bang, bang.
And the city
Not all autistic are the same. All of them are not aloof and silent and calm. Some of them are very aggressive and they have very dangerous behavior. Really a nightmare. Okay. Severe autistic spectrum again.
It was really hard.
This is a child. He's just
I think
has
the grieving
aggressive
process
behavior.
involved in it that never.
Aggressive behavior. He's getting calm. That's why you see. His little sister, she's afraid of him.
Tom, being the oldest, has taken on almost a father role. He's always he hand out for Max to stop him running away and look after him. Different for Harry because he's at that age where he's in between. He's smaller and
Okay, so now what you saw, kicking, aggressive, very aggressive behavior. Really, now we notice the self-injurious behavior, and here very aggressive behavior, severe tantrums.
This is Max.
This is all I intend on that. I intend of that. Just to understand when you are telling your plan, you need to mention such issues. When you are taking history, you need to know the extent of the disease, in which spectrum. So just the tantrums and how severe and how it takes over him. Does he have any aggressive behavior? Does he have any self-injurious behavior? So now you saw it by yourself, and yeah, I can say just to go YouTube and search for, and I swear I never ask anyone to go YouTube and search for, and he did it. The majority of you know they are overwhelmed with many other tales. If I did not show you, I think you will not search for, and it really takes very much effort to collect that. This video is Germany, and they are speaking Germany. And I even have a way to search in other languages. So I'm just sparing your effort and stressing on the meaning that I want to deliver to you. So it is not only YouTube, and I'm just collecting some videos. Some videos maybe 15 or 20 minutes. I'm just summarizing it in only 1 minute, 1.5 minutes. I'm just cutting for you the most important knowledge, the things I wanted to stress on it. So it is not only YouTube. Okay. Here we have mild ASD, and I have a very important message in this video. Thank you, Dr. Farah. Please not
einen kleinen Autist. Der Sami hat aber einen anderen wie ich.
Selim und sein Zwillingsbruder Sami. Sie sind der ganze Stolz von Mutter Alana. Doch seit die Brüder auf der Welt sind, muss sich die 29-Jährige für das Verhalten ihrer Söhne entschuldigen.
So he's not caring, just tantrums.
Unter Autismus
So this child has tantrum. When he's
verstehen viele nur, dass die Betroffenen Schwierigkeiten haben, Mimik und Gestik.
Here, one of the messages, this is autistic child. What did you notice here?
Nur, dass die Betroffenen Schwierigkeiten haben, Mimik und Gestik.
Pointing. He's pointing. Pointing means he indicates a need by pointing. You got it? He's autistic, definitely. But that's why we said mild ASD. So you may not find everything in him. You may find only few things. He lacked the eye contact. He lacked the social sharing. He's not attentive at all of his brother. So he just have one using the soup puppets, and the other one is normal one, just turning around, doing, coming, going, and he's not caring. He's just use the own toy in the same way every time. And even the child, the other one, try to play with it. He does not care about even the puppets. He just care about the circle in hand. Okay, so he's interested. He has obsessions. He has no eye contact. Yeah, he has some. If we put him on the scale, so this child may bring 30 to 35 in the cars. The message I'm telling here, this is a very common case in the exam, and the hallucination or the bad ideas in our mind that autism is just isolated. But this one, no, he's not that isolated. He's not, yeah, he has some features, but not isolated. So some guys may mistake him in the diagnosis. We will find that.
Unter Autismus verstehen viele nur, dass die Betroffenen Schwierigkeiten haben, Mimik und Gestik zu lesen, mit seinen Seifenblasen. Doch nur kurze Zeit später ist er völlig aufgelöst.
Sind gleich aus. Sagen, wenn sie aus sind, sind sie aus.
Es sind Momente wie diese, in denen sich andere Menschen von Alanas Zwillingen belästigt fühlen. Spricht kaum, wenn, dann nur 2 Wortsätze und leidet unter extremen Zwängen. Dann nur 2 Worte.
No eye contact at all. She's trying to engage him. There is no eye contact.
Spricht kaum, wenn, dann nur 2 Wortsätze und leidet unter extremen Zwängen.
Der Sami ist halt einfach komplett anders. Es ist so schwer in Worte zu fassen, wie anders er eigentlich ist.
Die Mimik seiner Mutter.
Er wird oft,
was für andere Mütter selbstverständlich ist, ist für sie etwas Besonderes. Zum Beispiel, als sie sieht,
you see what he's doing? He's following orders.
Das hat er, glaube ich, noch nie gemacht. Also beim Frühstück toll gemacht gerade. Freue ich mich voll.
So he's following
ihr Optimismus
the exam case. She was obeying orders. Let's play. She's play a tower. She's making a tower. Could you do that? She's doing everything, but no eye contact. She has echolalia. She has, so yeah. Not every child of autism is isolated, aloof one. So sometimes this is what we are saying. You have cooperative one. This is a cooperative autism. I think clear. We get the message. You may find an autism who follow the orders, and you see it now by yourself when he's taking the dishes and just started to put it. This means he follow the orders. We have one case. You just tell her, please do whatever she do it. But she have echolalia, and she has her own language, and she's stereotypy. She has stimming. So again, it is called spectrum. So some may have a score of 30 and others have a score of 55 and even 60. You got me? These are the most important. Now you know all the types. You may have one case cooperative, you may have one case uncooperative, but still the case is autistic. Treat of autism, the most important to say is behavioral therapy. And I need to, this is the summary. The issue is more than this, but because of the time factor, if you ask for behavioral therapy, the most important. Behavioral therapy, there are programs, it is called early intensive behavioral intervention, or EVI programs. this should be the following the criteria. If you know the names, early means should start as soon as possible at the age, once diagnosed at the age of 2 to 4. Intensive means 40 hours per week, almost a full hours duty, and this is 8 hours, 5 days per week. One-to-one behavioral training, and should be targeted towards SALT, child compliance, and peer relationship. So this is the most important. If you say anything else, it would be not be. You need to start at the cornerstone of treatment of autism is behavioral therapy, and this include programs like early intensive behavioral intervention. Other treatment include occupational therapy, and this focuses on the development of fine motor and adaptive skills, psychotherapy for the treatment of tantrums, physical aggression, and self-injurious behavior. I think now you will never miss that. You will never miss, because you saw it now. You know this could be a real problem. And just imagine one family have a child who has this severe aggression, he can hurt them, he can cause severe injuries to him, very bad. So now we need about psychotherapy. Treatment of underlying medical condition, like sometimes like phenylketonuria or congenital infections or fragile X. There are some conditions associated with autistic spectrum disorder. Pharmacotherapy include antiepileptic drugs. They have sleeping problems and they are treated with melatonin. Depressions treated with selective serotonin reuptake inhibitors and antipsychotics for those reasons. You need to know that it is only few pages and you can just tell the line. So behavioral therapy, these programs, it is called early intensive behavioral intervention. Others include occupational therapy. Don't say. It is more smarter to keep, don't say the details. So behavioral therapy, occupational therapy, psychotherapy. Here I need to say for the treatment of symptoms like 1, 2, 3, 4, and treatment of underlying medical conditions like 1, 2, 3, 4. Pharmacotherapy could be used like treatment of comorbidities like antiepileptic drugs, sleeping problems, or things like that. This means you will take only 1 minute to say that if he just to say behavioral therapy, and you need to straighten that the cornerstone of treatment of autism is behavioral therapy. Asperger's syndrome, this is mild autistic spectrum disorder plus near normal speech development. So this is, again, you will find it is mild ASD. So you expect now only few things will be there and the child has normal speech. Here, Asperger's syndrome, you need to know the diagnostic criteria. The child must manifest 1, impairment of social interactions. This is a must. So the one high up in the page, impairment, social interactions. Then you have restrictive, repetitive pattern of behavior and interests. And this disturbance must cause significant impact on social occupational functioning. So this word is the last word in every cognitive problem. So this must have a significant impact on social or occupational functioning. Autistic versus ADHD. I will leave you with this video.
How to recognize ADHD symptoms in children. Step 1. Note their capacity for concentrating. Most young children have short attention spans, but
you see now, this child has problem in understanding the task itself. So the task here is supposed to, I'm sorry, 1 minute. I cannot, 1 minute. I don't know why this one is not working. Anyway. Okay, So supposed to be there is a task, and that's why he did very something strange. Instead of doing this in rows, he just caused damage to the toy and just kick it on the middle. That's why this child is considered by others to be weird. He's not following instructions. So if he just go to play with other children, they are assigning rules, and he just make very stupid things. That's why they are very liable to bullying.
Those with ADHD don't seem to be listening even when they're spoken to. They frequently lose things, have difficulty following instructions, and often make careless mistakes. Step 2. Recognize if their energy level seems excessive, even for a child. Are they unable to sit without fidgeting? Do they get in trouble at school for leaving their seat, or running and climbing excessively or inappropriately? Do they talk incessantly? Interrupt constantly? Some children are more inattentive than hyperactive, and vice versa. Girls are more likely to have more attention problems, while boys more often fall into the hyperactive category. Step 3. Consider how long the behavior has been going on. If you've observed symptoms for more than 6 months, it might be ADHD. Step 4. Note where the behavior takes place. If it's only at home or only at school, something other than ADHD may be to blame for their symptoms. Step 5. Gauge the seriousness of the problem. Children with ADHD are regularly disruptive at school and at home. Their behavior causes problems in their relationships with both adults and other children. Step 6. If you recognize any of these symptoms in your child, take them to your pediatrician. It's important that they have a medical checkup to rule out other causes for their behavior before ADHD is diagnosed. Did you know children whose mothers had smoked while pregnant were more than twice as likely to have ADHD as children whose mothers did not smoke?
So I leave it to the end to get the message of smoking and smoking during pregnancy and relation to ADHD. Now, this is the diagnostic criteria for ADHD, and this is from the official NH site. Please go and revise. I just make a summary for you. You have 6 or more symptoms of inattentiveness, or, and this is extremely important, that's why I put it separately and make it in a larger font, or 6 or more symptoms of hyperactivity and impulsiveness. Impulsiveness means doing vigorously and in a rush way without thinking. So he looks like he's always in a rush without thinking. So suddenly cross the road, so they are liable for accidents. Okay, so this is the mean by impulsiveness. 6 or more symptoms of inattentiveness. They said you may have a child has more inattentive and he's not that hyperactive, or he's more hyperactive and the problem of inattentiveness not that much, or have both. So it is not a must to have severe inattentiveness and severe hyperactivity. What we saw in the video that, and you can discriminate this easily from uncooperative child or mild autism, that one never settle to accomplish a task. This is the secret word, the key. So the ADHD never settle to accomplish a task. If you just ask him, please do a tower, he never do it. Even 1 cube, 2 cubes, he will never. Always moving, always running, always doing, even nodding the head. You see, he's always in a part of a motion. So what we are saying, the secret word here, to just not mistake ADHD with autism, is to know that ADHD never settles to accomplish a task. Here, all of this must have a criteria. Number 1, continuous symptoms for at least 6 months. So not 1 week and then disappear and then another 2 weeks and then disappear. No, it should be continuous for 6 months at least, and started before the age of 12. And here in at least 2 different settings, and that's why it was 1 communication scenario in the exam about ADHD. We are gonna make it together. Then strong impact again on the social, academic, or occupational functioning, and not better accounted for by another condition. This is what is written in the official NH site. You need to know this by heart. It is only 1 slide. So again, now you have criteria for Asperger, you have criteria for ADHD, and you know autism, the rating scale. There are no specific criteria. We do it by screening scales. Double tasks. You said, yeah, many times. This is the most frequent I've been asked for, that there are no more double tasks. And one of the senior examiner, I hear it by my ears, he say, no more double tasks. But the reality is different. I will not talk about this. You will see it by your eyes. If you got a case with fine and the gross motor, and this is lately, last UK exam in June, you will have cases with double task. Last exam in June. And since 2017, they are saying no more double task. And from 2017 till now, there are still, in some situations, yeah, not common. I can say it is 5–10%. It is not that common, but it is still there. So no place for adventures, know the game, just to know the game. Here, fine and the gross motor, start with the fine. You'll never be able to do everything. You have 6 parts here in fine motor. So what they are saying, just use 2 things, not consuming time. And these 2 things must include the cubes. So start with the fine simply because if the child saw the paw, he will never engage you in smaller things. So he like the motion, he like jumping, he like running. So it is difficult to let's ask him, please sit, let's play with. That's why start with fine and complete with the gross motor. Anyway, the gross motor does not take time, and the gross motor only, all the gross motor, you are able to do it in 2 minutes. So no single task examine the gross motor, but usually they are saying fine on the gross. Very rarely to say gross motor alone, unless very young child, 1.5 years. So you may need to spend some time with them. So this is again fine and gross motor. Start with the fine. You will select only 2. So paper, crayon, and you can make even the scissor with it because it will not take time. All of them can take only 1 minute, and then the cubes for 3 minutes, and then gross motor in 2 minutes. This means you will be able to do in 6 minutes. So this is fine and the gross motor. What they are saying, do only 2 tasks. If in doubt, do a 3rd one. So I have 2 tasks, paper and crayon, and it gave me age of 3. But in the poll, he gave me the age of 4. I am in doubt, so I will see the scissor. Now he cut continuously. This is more the age of 4. I will say he's closer to the age of 4. So 3.5 to 4, this will be my assessment. So I will do 2. If in doubt, do a 3rd one to see to which direction it moves, more to 3 or more to 4. So, but only 2 is enough, and go do the gross motor. All of them, you just run, walk, jump, hop, all of this 30 seconds, and then you start bringing your ball and to see catch, throw, another 30 seconds you saw in the videos, does not take time, and then ask the mother about the stairs and ask the mother about the bicycle or tricycle. Fine motor and hearing, again, very famous scenario, start with hearing. Usually when you have 2 big things like that, one of them is not there. And this is the case in the exam. He has mixed. He has, let's not avoid the word mixed. He has expressive aphasia secondary to receptive one. So this child, you go from behind, whisper the name, no name. You come, start with the hearing. What's your name? No answer. And then hide, what's your age? Boy or girl? No answer. Can you say, can you say? No. It does not take anything. Just the 30 seconds, you discover he has no expressive. And then ask him, show me the car. Where is mom? Where is dad? Point, no. Again, it will not take any time because he does not hear you. So all hearing will be finished in 1.5 minutes. Then go continue the fine motor. Usually they are able to do the fine motor, and that's it. So you need to be just ready for the double task. Cognitive, if the examiner asks, please examine this child cognitive behavior. So again, cognitive means hearing and means social. Which one to start with? Hearing. Again, you will find problem in one place, and that's why one of them is just abolished, and that's it. There will be no place to assess two things at the same time. But if he's okay, don't do everything. Just only two things in the hearing, like name, sound, and story, and then run to the expressive verbs, nouns, and verbs, then prepositions, comparatives. That's it. Run. Because double task, you will never be able to do everything. You need to select two things from here and two things from here. Now we've finished our presentation and our strategy and plans about the second part, which is the cognitive part. We have here some mark sheets to revise together, and this one. This is UK based only. That's why I am not bringing all the mark sheets. It is written here, hypotonia, and he does not write the age of the child. So hypotonia, and he just give pass, fail, clear fail, and overall give fail. You did not assess her grasp. It is written here. You did not assess grasp, palmar grasp, I think, or anyway, you had to be prompted to complete. So he come to a point and he stopped. And discussion, poor time management. You said child could make a tower of 2 to 3 cubes, but he did not. It is not a big deal. Pencil grasp, yeah. So this is so now every word we are saying, it is related or based on things. Let's move here. What? It is either not a supported file type or because the file has been damaged. So without my computer, I feel lost, really. Here, tiring fast. And here, lovely introduction and rapport, used interest appropriately. Used here, interest appropriately. Here, you saw some of the examiners, this is their favorite way. Breaks, and anything you do, he just put, so she did a tower, and she did not try a bridge. She did try drawing, then form board, then nice use of equipment removal, handed toy to the left hand to shake the handedness. Okay, so what she did, just tower and drawing, but no board, no bridge, but overall he liked her way, or like his way, and he gave clear paths. This means your style really can make a difference. Here, able to summarize, consider other areas that she noted despite child becoming rapidly tired. So she noted that she has hypotonia, and that's why she offered to do gross motor, most probably, and despite the child becoming rapidly tired. Again and again, your style really the examiner may overlook many things because you overall you are nice and lovely. CB, developmental delay. Here, coped well, adapted well to the child. Cooperative, patient or parent. Developmental understanding of fine motor. Goal, slightly uncoordinated. That's why, just a slightly uncoordinated plan. So one area, that's why he deduct 2 marks. You see, and this is really very bad if you just go and make that. We saw that many times when you just go there without a plan and start to say a multidisciplinary team like, and you don't know which one to start with and which one I said and which one I forget. But if it is organized, medical, paramedical, you will just say medical, who I need to get from the medical one. Then finish to move to the paramedical, and then you get all the related paramedical. You have, looks like you are in a supermarket and you are just selecting from a basket. Now I am in the area of detergent. Which one I use? Which do I need anything from this area? No. So let's move to the genetics test. Need it or no? No. So education support. You will find yourself telling. If you just organize your head, you will be brilliant telling the management plan. And again, in the history, it depends on history. If you pick a plan like a financial, you need to say the mother has a financial problem. I need to involve the social worker and for like a disability living allowance or any income support. Here we have trisomy 21. And what is written, good organization, but I don't know good what with the patient. Targeted exam to gross motor. Mom offered to help a few things before candidate reach to when exhausted with the patient want to engage with the mother. He picked trisomy 21 features and justified give age 10/12 maybe, but I noted that he gave this may be the developmental age, but her age was 23 months. So this is the full mark sheet. Walker, you saw the picture of Walker. She's very famous and usually come in Egypt, sorry, in Jeddah, frequently come, and I hope you will not meet her. She like, if you just saw the mark sheet, she like writing too much. And this is a habit. All mark sheets of Walker, she never stopped writing. For me, she little bit cruel. So this is the name, I think, hilarious. And age 5 years, 9 months, and she's, I don't know what is that. So here, hearing a speech, hearing checked, not grade done. So grade, I don't know, not grade done of language for a child. Here did not find jumped around. Anyone can help. Choice of language. So this is a common scenario for her. She say you are not using appropriate language that the child can understand. And here you have achieved the perfect because your assessment wasn't very structured, wasn't structured. You bring something from an area or from a modality, and then you jump into another modality. Like, what is that? Anybody can help on that? Clueless. This is
colors.
Jump
colors.
from one modality, like color.
Yeah, jump like colors to another, like
animals or commands or country.
Commands or country. So continue reading.
Counting.
Info giving time to
giving time to really check. You did go back. He did then demonstrate
skills at a more advanced stage.
At a more advanced stage. As a result, you underestimated his ability considerably.
Underestimated his ability.
Who underestimated his ability considerably.
Considerably. So what she's saying here, Ma'am Walker, he's not structured. So he's the color and then jump it to the commands. You see, colors was in which area? So
Speech.
colors. So this is, yeah, I know, all on speech. Colors and commands all on speech. But expressive or receptive?
Expressive.
Yeah, exactly. So this is one modality. So he did not do the best in the modality. So he needed to say colors, do everything about expressive, then move to another area like a command. But he was just chaotic, randomized. He does not that, seems that he has a strategy. That's why she did not like. And she said, after you did not give the time for the child, you did not try once and twice, and you don't have a backup plan. And that's why after that, the child make things which is more advanced than you think. But that's why at the start, let's say, for example, what's your name? You just say the name. Then what's your full name? The child gets shy. And I consider he is not able to. I give him 2. Sorry, 1 minute. So I consider this is like, okay. But after that, he did the age of 4 and 5. And this really make a very bad difference. Usually we are talking about 3 or 4, 4 or 5, but not 2 and 5. 2 and 5 too much. And that's why he did not notice that he does not follow the pillar and he does not testing for more advanced, more advanced, more advanced. And sometimes if I just see my child is doing everything is at the age of 5. Okay? But only one thing which looks like outlier, you know, the outlier in statistics, which things which out not match it to most majority of the finding. At this area, I need to say, he may not just the area of the name and age and sex, he may be shy, okay, or lack of training, be, okay, that's it. So this is how I'm gonna explain the things. If majority of things is around 4 and I have one thing at the age of 2, I need to say this is outlier. I think we've learned this too much, and although I cannot able to read her handwriting, she said here again the same girl, Williams syndrome. I read it hilarious or William. I think she's Williams syndrome. I don't know. So again, the same age as the same child, and here trying not to say, oh my God, so much. And not great at, again, not great at, who help?
Keeping his attention. Keeping his attention.
In keeping his attention, and what is that? Was trying, I think.
Alice.
Then, anyway, here she said word learning comes at, this is comes at stages, or I don't know what is that. So you are using word learning, correct words in English, like under the table, not beneath the child. So he's using the word beneath, but the cube beneath the table, and the child with difficulty may not be able to understand you. You see, she's commenting a word. This is Walker. For me, this is a little bit silly. The child understand and he did it, that's it. But she just comment on that and he give him perfect because he's using language not appropriate to the child. For me, this is not overseas, but again, somebody is eating on my ears. myself. Okay, so now again you see she's found of writing. Because you started well, but you really lost focus and use any strategy to re-engage the child. You also used a language that he might not understand, like beneath the table, and so she punished him twice. One in a word, and that he does not have any strategy. Again, Walker, 27 months, 2 years and 7 months, 5 more. And she gave clear pass. You did well at this station. We do recommend that you did not talk through the station, but want to put signs together. Until had a chance to fresh assessment, or I don't know what it is. Anyway, something
Finish.
Finish. A chance to finish assessment. Gross development assessment. Year-old. Give you a pass, not clear pass. This was no fluency. There was no fluency. And discuss cause of development delay in a 26/40 baby. Okay, so this is a child prematurity, so he may have IVH, he may have CP, he may have many other problems, other hearing problem, visual problem. You know, the disability in prematurity you need to know by heart. Missed the hydrocephalus, VB shunt, and give a diagnosis of achondroplasia. I think it was obvious enough that missed it with achondroplasia. And I think the head was extremely large because he's not allowed to touch the child or examine the child neurologically. But you need to say at least the head is large for his age. And I need to confirm by taking measurements. If you have a child with hydrocephalus and set appearance of the eyes, I think it can be a spot diagnosis, but it looks like it is obvious enough so the candidate himself noticed and they say wrong diagnosis of achondroplasia. And I think again the examiner told him that he was preterm, because again it's clear from the question that what are the causes of the delay in a preterm baby. Let's ask clinical. So trisomy 21, gross motor assessment. Down syndrome, she gave him 12 to 15 months. So the age was 23. So age of the child only almost 2 years. And now you see that he gave him age of 1 year. In which area? In gross motor. Okay, see, that's why we are saying, right, you think that gross motor only walk, jump, hop, things like that. No, you may have a child who has marked hypotonia and he's just can't sit or just can't stand or even few steps walking independently. So this means you need to know what else. And here in this we said the things like prone to set, prone to supine, and the vice versa, head support and pull to set. All of these are just you know the technique. By the way, you must know the technique. Just put the child on his supine or his abdomen and put a pole or any colored thing and beside him and try to just engage him and say get his attention just to turn himself to from prone to supine and otherwise, and then try to let him sit either alone or with the use of the mother if he's able to. Okay, now put his again in his abdomen and try to put a far object for him to creep and see if he can pivot or no, then pull to stand and things like that. I think very easy. If you just know the areas, it will be very easy. And I think now it is clear that you need to know that the child developmental age was 12 months. Seven-month upper syndrome, gross motor and fine motor. So in any case of craniofacial syndromes, anyone can remind us what are the most important things to do. Never to miss. So you will get the characteristic features, protruding eyes, and looks like characteristic features of craniofacial. But here we are stressing in the most important two things in case of craniofacial. What is that?
The hands.
So this is number one. Hands is the number one.
Yes.
Apert is a very common case in Jeddah. Apert syndrome in the last three exams, it came in the last three exams. They are poor center and the cases are limited, and Apert syndrome is known case to come in Jeddah. So this is enhanced. What else?
Yes.
What you will search? What you will search?
If it is have the trigonocephaly,
yeah, you are close in the skull, but there are things which are more important in the skull. Anyone can help on that?
But the skull is usually flat or boozing too much.
Overriding of sutures, yes, we are almost there. It is about the scars. Those
scars of
children,
operation.
Yeah.
No.
Go craniofacial. So I have two targets. Look at the hand and bring the scars. And please, each centimeter in the scalp, you need to look for a scar. Usually the scars follow the suture lines. So you need to bring scars and say there are 1, 2, 3, 4 scars. You may find as many as you never imagined. Okay, so this is number one. Number two, what are the causes of delay in such a patient?
The delay of the operation done is late diagnosed.
If it is late diagnosed, you will find this patient has cognitive problem. But if it's done early, so we have a plan. Any case of craniofacial, what do you think? I need that.
Here, problem from feeling.
Exactly. Now, we said we have a rule. Case of craniofacial, the four senses are affected. So four senses in the face are affected: eyes, ears, nose, mouth. So all this you need to consider any case of craniofacial. So Poisson, Pfeiffer syndrome, Apert syndrome, you have like Treacher-Collins syndrome, you have golden hair syndrome, all of this sharing the same criteria. So blindly, now we are minimizing the use for memorization. Blindly, all four senses are affected. So Godefroy encouraging appropriate play skills, developmental. This is what she wrote. Steps drawing, cannot draw a circle. This is what anyway, she gave at the end, he did everything, and at the end she gave clear pass. I think we are ready now if you have a case like that. One of the things which does not want to be opened, I wish I can get it. Here for developmental station. Didn't. I'm sorry, did not what? Stretch patient with his skills. Fine. You know what is the meaning of stretch the patient?
Means did not
Go up.
encourage him or
this means he does not challenge him. So he just make a task at the age of 3, this is enough, and then move to another issue. So he is not going up with the patient. This means you did not stretch the patient. Stopped rather than stretching him. So he did a bridge, and this is what we said. He did a bridge, but not steps. So you did not offer to do a steps. He may be able to. And that's why we said ever is he able to do bridge, do a steps. If he's able to do a small steps, make a larger one. If he's able to make a larger one, always never stop, go up, go up, go up. So this is the mean you did not stretch the patient. Here, developmental conclusion was wrong. Patient had fine motor skills of the age 3 to 4, 3.5 to 4, candidate left 2.5. I think this is very poor assessment. CP of both legs. So CP of both legs means diplegia. Apparent developmental age and behavior of will identify the left arm. So I think this could be hemiplegia. Anyway, all the issue about identification, just that's it. In cases of hemiplegia or diplegia, number one, you need to say, I got it. And number two, to give a good developmental age. Right hemiplegia, type 2 walker, the right leg, and decreased use of right arm. Here, scissor skill done, drawing done, did specifically test for copying, did test for skill, missed left arm, you see, missed left arm dominance. You see now what we are, that's why I think we have a plan never to do that. It's very common, missed left arm dominance. You mentioned he was neurologically normal and he has hemiplegia with CP, that's why dropped. Anyway, I think now we know the mistake of this guy. He just does not test for the child appropriately. He does not look for the hand dominance. This is, I can see that if you don't have a plan. We were in a mock and there are almost 10 candidates. Only one lady, she picked that this child is not using the right hand. 1 in 10. If you are not primed, this is our exam cases, and you need to start with just putting the crime between the eyes, between your eyes and the child eyes, and then give it intently to his left hand. So does not cost you a dime. It does not cost you anything. How much it takes? Nothing. But now you see the importance of such things. Now I just ruled out 2 important things about squint and about or stigmas or any eye abnormality and any use of the handed dominance before the appropriate age. Does not interested much, just to give instructions, seems to freeze. You see, we are talking about the style. So he's not engaged, he's not enjoying, that's why he does not like him, and that's why you will see clear fail after that. No obvious systematic approach, you seem to freeze and do not move to various supports, did not use ongoing small enough to test think, did not use history as a tool, did not, anyway. So he just did not do anything and he was not a good guy. Clear fail and not a clear fail because you did not elicit what? appropriately. History. You messed up few crucial milestones. There was, but anyway, it was very bad overall. There's the most this. There are here two important. I need to open with anything else. Open with. There are anyway to open with. These things. I don't know why not opening. Very important because I remember the first two stations was. I think there is a problem. Anyway, I think we've done anyone need to ask about anything? There are one of them. This is because I just moved from one computer. The summary, this one case here, it is fine motor and social behavior. Double task. One of these two. That's why I'm insisting to try to open them. I promise you that you will see by yourself, but I need to say inshallah. I'm sorry for that. Anyone has anything to ask for or anything which is not clear?
Thank you very much, Dr. Yusuf. Everything is very clear, more than clear, and really it is always helpful. Thank you very much.
Thank you, Dr. Tariq. Jazakallah khair. Thank you. Okay, here about waiting the record tomorrow, inshallah. Not able to concentrate.
Hello?
Yeah, hello.
دكتور يسري شكرا لك كثير الله يخليك. I want to ask about when you said about the double task, you said fine motor and hearing. You mean hearing and speech or only the hearing?
Even if he's just to say, assess this patient fine motor, hearing, speech and language. It is the same. If he just to say, assess this patient speech and language, and he did not mention hearing, you must test for the hearing. If he say hearing and he does not say speech and language, you need to assess. They are looks like a continuity. So whatever he said, you will test for all.
If he said fine motor and hearing, what I will do?
We said that. You just to come from behind, whisper the name, he's not responding, and then come sit in front of him. What's your name? What's your full name? You are a boy or you are a girl? You just to go the continuum. Okay.
I will do all the colors, preposition, all I will do?
You will do. We say in double task, there is no time. You need to be select some from here, some from there, and run. And it will not take time because he's not answering. He's not understanding. So اسمك ايه؟ طب كم عمرك؟ طب أي حاجة. He's not answering. Okay. And then ممكن نغني سوا. You will say and he will not do. You will do all the hearing. You can do it in 1 minute. So I'm telling you, when you have two big different stories, one of them will finish early. You get it?
Okay. I have other question. The summary you told us to do is summary for examination or for all? Because now in the development, I will take history and I will do examination. So what about the summary of the history? Because in the history, I asked about when this condition present. I asked about the hospital admission. I asked about the family, the social. So this, how I will put in presentation in the summary.
Okay, if the history is completely separate, so you need to say by examination and by history taking. And in the history taking, we have way to summarize. The way we said it, very good question, by the way. The mother concerned history taking revealed the child has hearing problem, started at the age of whatever, and this is associated or in the background of. So the words is number 1, the concern. Number 2, on the background of. Number 3, associated with. So again, so the main concern, hearing. In the background of meningitis at the age of 1 year. And this is associated with, you can say, the global developmental delay or or whatever you need to say in the 4 aspects: multiple admission to the hospital, use of medication for epilepsy. Don't say the details because it is supposed to be a summary. So you just say no details. Don't say he's using 1, 2, 3, 4. So using anti-epileptic drugs and also associated with financial and emotional problems. So in the summary, never tell details, only items. And he was listening and he was there and he was just to say, like what? So this is now he can ask about. Because you are, if you just tell that to the examiner, this means he will get the message. So in this way, again, you will never miss anything. I have number 1, acute problem or the main concern. And this is on the background of, this is the history of diagnosis, any chronic illness, anything. And this is associated with the areas of development involvement and whatever else in the hospital related history, and also in the social history, family and social history.
Okay. Thank you very much.
Could you say what about the object 9 months?
So object permanence. Yeah. You were sleepy or what? We say object permanence. We said the child understands that things are still there or no more there. So in Arabic, I will say it in Arabic and I will say it in English. البعيد عن العين بعيد عن So anything which is away from his vision, he considers this is lost, not there, because he has not the ability. This is higher function of the brain to say that, take care, this thing is still there. Despite, yeah, he may hide my face with my hand, but the brain understand that, no, I'm still there. So he's waiting for me. So this is a higher function. He say the object is still stay in place. This is the meaning of the permanence of the object. But if it is not developed yet, once, that's why if he just have a cube and this cube falls from hand, this means now out of sight, and this means it is not there. This is no object permanence. But if the cubes fall on the ground and he starts to look at the ground searching for it, this means he understands that the cube is still there despite he's not seeing it. This is what's still the permanence of the object. This is a higher brain function, usually developed at the age of 9 and the limit age at the age of 12.
Dr. Yusri, can you repeat the impulsiveness in the ADHD?
Again?
In ADHD, regarding the impulsiveness, can you give the example?
I told you when he's just beside the mom and suddenly cross the road. This is the meaning of impulsiveness. He's not thinking. He's not looking right and to the left. He's just to do without thinking. So the impulsive has 2 components. 1, being in rush. Number 2, no thinking. This is the meaning of impulsiveness.
Okay, so should we, can I ask a question?
Sure.
Yeah, so you are recommending that in development we should, after entry, just after introduction, we should go for history, then play, right?
Yeah, exactly.
Yeah.
This is, again, this is not my advice.
Yeah.
Again, we are depending on this situation on senior examiners, the most senior one. And this is the advice of the senior examiners. They said that you will take history exactly. If you are trained, you will take it in 7 minutes, 6 minutes. This means you will have good chance with the child. But if you do it the reverse, if you play it with the child, believe me, the time will be run and you will not get alert unless you hear the ring. This means 4 minutes for the history. This is not enough. So that's why they give advice, start with the history. And who did that? They said, yeah, exactly. It was a good advice. So who started with the history said, yeah, it is a good advice. And in Egypt exam, I have feedback from almost They were 48. I have feedback from 30 of them almost. Okay, all of them said we played with the child for 9 minutes and we take history in 4 minutes. The majority, let's say 90%. This means start with playing is not a good thing. It is not one person mistake. It is about, no, the majority are in the same area. That's why the advice, yeah, I see it. We are learning from the mistakes of the other. You got this issue?
Yes, yes.
That's why we are revising the mark sheets together. We are learning from the mistakes of.
Yes, yes. One more thing. If my command is to assess hearing, so suppose I have taken history. When I'm going to start the play with the boy, should he ask the mother about the concern again?
They are separating this from taking history from playing.
Yes, yes.
So if you just finish history, so now it's time for play.
Yeah, when I'm going to start my play with the child, should I ask the mother about any concern regarding hearing or?
No, you took the history already.
Yeah, that's what I.
You took the history already. No need, خلاص. You got everything, and even include what are the language you are using at home. Everything. This is done in the history.
So in the history part, we can complete all these things.
Yeah, go through.
Yes.
Just to keep the things you can, for the sake of the time, you think that this is 3-year-old child. So just to spread the things you need to test yourself. Don't ask about it because you will see it yourself. You can spare this, or you can just run through. So not in details,
and
because
whenever we are taking help from mother, should we ask permission from the examiner?
Help for the mother in what?
Yeah, suppose I'm playing with the boy, sometimes I may need help from the mother to engage the child. In that case, if I want to use the mother, should I ask permission from the examiner?
It depends on the place.
Yes.
If in UK don't ask for any permissions. In UK, they don't like to just get separated from the situation and continuously looking to the examiner. They don't like that. Okay? So
Yes.
in UK, no, but overseas, no, they consider this is, you need to take a permission. Overseas, in some areas of the world, it depends on the examiner, you need to take permission. It depends on the situation.
Okay. Thank you.
Okay, welcome. Okay, guys, I think we've done. Anything not clear? Thank you. Thank you.
Tomorrow, which time, Dr. Yusri? You repeat the session?
Usually we are repeating